Thank you, Dr. Pankaj, for coming to the Flawless Growth podcast. I am super excited to have you here.
Well, thank you for the invitation, Maria.
Absolutely. So, to start it out, can you tell us a little bit more about yourself and also what led you to reconstructive surgery? What led you to inspire to go in this field?
Sure. Well, I'm a plastic surgeon by training, and after my plastic surgery training, I did some specialized training in reconstructive microsurgery, really for all types of cancer at the MD Anderson Cancer Center in Houston, Texas. And then I moved to Columbus, Ohio, where I've been for 17 years. And I was initially at the James Cancer Center, which is a very large cancer hospital. I ultimately left there and started my own practice called Midwest Breast and Aesthetic Surgery. And we really focus on cancer reconstruction, primarily breast cancer reconstruction. We
Mm-hmm.
do some more complicated, what's known as microvascular reconstructions, where we take patients' tissue from, let's say, the tummy tuck area, and you can actually transplant it to the chest to recreate a breast. So I think from a functional, from a cosmetic standpoint, there are a lot of advantages for patients over implants, and it's something that I've spent really my career doing, and so I like it. I think it's a wonderful way to get to know patients, to help them through their cancer journey. It's very gratifying from a professional and personal standpoint. So, yeah, that's pretty much what I've been doing.
Yeah, that sounds super gratifying, especially because you're giving women a lot of, or a little bit of their confidence back. So I'm sure that's super, super fulfilling, and I'm sure that they're super happy after they go through a surgery with you.
Yeah, these are big surgeries. There's
Mhm.
no doubt about it. I never like to
Yeah.
minimize any type of surgery, but I do think that it is a bit of a light at the end of the tunnel of
Mhm.
what, for many patients, is a very difficult journey. And I like to think of the reconstructive surgery portion as maybe a little bit of a happy ending to
Yeah.
what is a difficult course. So, although reconstruction in itself is complicated,
Mhm.
we never want to minimize that. I think your point about restoring confidence is a really good one, because that's really our goal.
Yeah. And when was the moment that you decided to open your own practice?
Um, so I had been at the Ohio State for about 7 years, and I
Mhm.
love it there. It's a wonderful institution. I love my patients there, the people that I worked with. But for me, skills in a way that I could really focus breast cancer reconstruction. And the ability to do that with my own practice, I think, gave me more control, more autonomy,
Mhm.
and really allowed me to improve my skills, improve the patient care experience. And I think all those things ultimately led me to wanting to leave. So it really wasn't a dissatisfaction
Mhm.
with Ohio State. It was more, sort of a need to grow personally
Got it.
and professionally. And I think that's what creating my own practice gave me.
And what are some of those changes? Like, what are the ones that you enjoy the most?
Yeah, it's a great question. I think that what I enjoy the most is that from a really purely technical surgical side, I can do things now that 10 years ago I really would have had difficulty with.
Mm-hmm.
So for me, that's demonstrated a lot of personal growth, a lot of surgical growth as a surgeon. I enjoy the business aspects, to be honest. I
Mm-hmm.
like building a business. I like um, kind of recruiting and hiring people and
Ah.
training people and doing it in a way where we have. And so I think the ability to micromanage that stuff is
Mm-hmm.
nice for me. I don't think of myself as a control freak, but I think I am at my core a little bit of a control freak.
Yeah.
And so I think it feeds that need.
Well, I think that being a surgeon has definitely a little bit of a control freak nature because you need to be very, very detailed. You need to be to do everything right almost all the time. So, like, what makes you great at being a surgeon? It's part of that control freak nature, which is it is what it is.
Yeah, I think I've become more control freaky as I've gotten a little bit older, maybe. Which maybe you're supposed to get less control freaky
Right.
as you get older, but anyway, it's gone the opposite for me.
Okay, that's funny. But do you think that it's been apart from in the surgery side? Do you think it's been mostly positive for the business side?
Definitely from the business side.
Yeah.
The surgery side, I think after some time you get very comfortable with
Mm.
the mechanics of surgery, and that's
Mm-hmm.
good. You want a surgeon who's very comfortable with the
Yeah.
mechanics of surgery. But the business piece always involves um, working with other people, and
Mm-hmm.
people are sometimes great to work with, sometimes difficult to work with, and everyone's got their own sort of vision for how things should go. So, really getting everybody on the same page, I think, is one of the unique challenges when you have your own private practice in medicine and you're interfacing with the hospital, plus surgery centers, plus things like insurance companies. So, all those things are you've got to sort of get everything in the right everybody on the right bus.
Yeah, totally. And it's important. It's just part of also being an owner and a boss. I think I'm also a tiny, not too much, but I think I am a little bit of a control freak too. And I became more
How
of
are
it.
you? How are you control freaky?
Well, I like things to be very perfect, even like little details. So, for example, we do ads, and if I see that there's not um, a final like point in an ad or a capital letter where it should be, I go back to my employees and hey, this needs to be like this. And I've got like they've said, but sometimes you're too much of a perfectionist. Like maybe that detail doesn't really matter. And I'm like, it matters. That's how you separate yourself from the rest. That's how you become
Yeah,
the
if it
best.
matters to you, then it
Yes,
matters.
exactly. So, but also it's good that like when you receive feedback because you go back to yourself and you review and you think, okay, am I being or not? Okay, what is your core philosophy when it comes to patient care and outcomes, especially
Yeah,
in this area which is very sensitive?
yeah, I love that question. I think that my personal philosophy is that for breast cancer reconstruction, there are actually a number of options that we can provide for patients to get them to a reconstruction. And I think it's very important that whatever plan we design is the right plan for that patient.
Mm-hmm.
So I don't like a one size fits all. I think that understanding the patient's professional, personal situation, what their hobbies are, what their activities are, all those things are part of, designing the right operation for them. And of course, that takes into account their anatomy, their
Mm-hmm.
cancer treatment. These are all variables that have to be addressed as you're deciding what type of operation may be best for them. And I think if you can do that in a thoughtful way, it will give them the best outcome with the least potential problems down the road. So I think one of my core philosophies is really understanding what's important to the patient.
Mm-hmm.
And at the end of the day, people come to me with a problem,
Yeah.
and my job is to solve their problem. And the way I solve that problem is with technical surgery. But at the
Mm-hmm.
end of the day, I think of myself more of a you know problem solver, solution provider, even than a surgeon.
Mm, understood. And you mentioned at the beginning a little bit that when you started to being a business owner, you learned a little bit more about techniques and you were able to expand a lot your knowledge. How did you approach that? Was a little bit more like experimentation, or where did you learn new techniques? How did you grow more? professionally.
Yeah, I mean, I think there was that book by Malcolm Gladwell that talked about the 10,000 hour rule.
Mm-hmm.
To be good at anything, you have to put in 10,000 hours. But I think a corollary to that is it's not just the 10,000 hours. It's sort of, at what stage of your career you're putting in those 10,000 hours.
Mm-hmm.
For example, like when you're training at anything, that 10,000 hours gets you to a certain level. But maybe once you're at that level, that next 10,000 hours, you have some exponential growth. And then the next 10,000 hours after that, the curve is even more, upward sloping. And I
Mm-hmm.
think that for me, um, the more I operated, the more sophisticated my understanding of these procedures became.
Mm-hmm.
And I think it was more does practice make perfect? I don't know, but practice certainly makes better.
Yeah.
And so I think the the more I operated, the more exponential my growth curve was. Which is like anything else. I think you get to a point where like your growth then starts to slow down.
Mm-hmm.
And but I think from a technical surgical standpoint, I feel very comfortable with my abilities to do these more complicated operations, and our outcomes are very favorable. Our problem rates are very low.
Okay.
So that's the type of place where I think you have to get to.
Mm-hmm.
But the only way to get there is to really, in a very systematic fashion, go through these 10,000 hours, and do it in a way where you're sort of pushing yourself each time.
It's that compound interest, right?
Yeah, that's a
Mm-hmm.
great way to think about it.
Okay,
All right.
and is there any new procedures, techniques, or technologies that you're excited about?
Yes. So an area that I'm really interested in is fat grafting. So
Huh.
what is fat grafting? Fat grafting is liposuction. We've all heard of liposuction, where you remove fat from maybe the tummy or the thighs or the hips, things like that. But you can actually use that fat for a natural breast augmentation, for example. You can use it for all types of reconstructive surgeries. And a key to that fat is the viability, the longevity of the fat. And I think there's a lot of opportunity to improve the way we not only harvest the fat, but also process the fat to improve its longevity and the reproducibility of the results. So I think it's a super interesting area. I'm going to a conference in Pittsburgh in just a few weeks. I think that's an area that I'd like to spend some increasing time understanding and thinking about, and maybe put in my 10,000 hours, because I think that that's a place where we can make a real sort of improvement in the way things are done already.
Yeah, because as per my understanding, correct me if I'm wrong. Sometimes that fat it won't last as much, or like the body will consume a little bit of it, and so the idea is to improve
It
that.
does.
Uh-huh.
Yeah, but it reserves about 50%. So that's a lot,
Mm-hmm.
half of it going away. And so I think
Yeah.
there are some techniques that I've used. I'm sort of developing a process now to get those resorption rates to under 20, hopefully under 10%, so that we can retain 80 to 90% of the fat. And I think there are some changes that I've done. I like to think about it in terms of soil and seeds. So in
Mm-hmm.
this case, the fat is the seeds, and the tissue that you're placing the fat into is the soil.
Mm-hmm.
So you need excellent seeds, you need excellent soil to
Mm-hmm.
get a good crop harvest. And I think it's very similar with fat grafting. You need, very good technique for how you harvest the fat. You need to be able to optimize where you place the fat. And I think those are both really important to get the best outcome.
Mm-hmm. Because with
Yeah, I
fat,
like.
yeah, sorry, you cut in a little bit. Because
Yeah, I
with
just think I like plastic surgery because it gives you the chance to do these, sort of think out of the box a little bit.
uh-huh,
Because it's
uh-huh.
not a very sort of algorithmic way to do things.
Right.
It gives you the ability to think out of the box a little bit.
Right. And with these fat techniques, things can look a little bit more natural too, right?
Yeah, I do a lot of, I see a lot of patients who've had breast implants for either
Mm-hmm.
cosmetic procedures or for reconstructive procedures who have problems with the implants. Some
Mm.
people call it breast implant illness.
Mm-hmm.
It
Mm-hmm.
may be a inflammatory problem, just inflammation to the foreign body.
Yeah.
And so a lot of what I do is a more natural reconstructive option. So whether
Mm-hmm.
it's for breast reconstruction, where we're transplanting tissue from the abdomen, or whether it's a natural breast augmentation with fat,
Mm-hmm.
I like to think of myself as the non-implant doctor, more of like
Mm.
the natural versus implant-based plastic surgery.
And what are your thoughts related that inflammation that can happen with the fake with the implants? Um, that from my understanding, that's not like all the way scientifically proven yet. But do you think that it can
It's
really happen?
not.
Uh huh.
Yeah, I really do.
Yeah.
I really
Okay.
do think that there is an inflammatory component.
Mm.
I'm following up with my patients who are at least a year out from surgery,
Mm-hmm.
and we're giving them a questionnaire about what their symptoms were, how their symptoms improved after the implant removal. And so I'm
Mm-hmm.
hoping to put this together, some of the data together over the next year or
Mm-hmm.
so that we have a bit more of a scientific approach. It doesn't explain why people are having symptoms
Right.
as much as categorizes what the symptoms are and maybe what the recovery has been. But I think you're right that there is not really a scientific explanation. And I
Mm-hmm.
think this is quite a controversial area.
Yeah.
I think many people would say that this is not a real entity, but to be fair, in my clinical experience, that's not what I have seen. What I have seen is that patients are improved symptomatically. Many of them, it's a uh, pain associated um, problem that is improved. And I think that
Wow.
makes a lot of sense to me. When the implants are put, they're typically placed below the muscle.
Uh huh.
You may have had implants in, let's say, your 20s, and
Mm-hmm.
now you're in your 40s. You've
Mm-hmm.
had hormonal changes, you've had muscle mass that's decreased as you've gotten older, which of course we all do. I
Mm-hmm.
think that same implant under that same muscle now creates more discomfort, not only because of the muscle mass changes, but because of maybe some migration of the implant and where it was placed. And I
Mm.
think the leading thing that brings patients to medical attention, and we see this in the delayed breast cancer patient also, it's oftentimes not the way it looks,
Mm-hmm.
but the way they feel. And it's not the cosmetic appearance,
Mm-hmm.
but more the functional issues that are bringing them to medical attention. And I think that goes back to what we were saying earlier. It's very important to understand what the patient's uh, goals are, to understand what's important to them. What are their hobbies? What are their activities? What do they do in their personal and professional life? Because a lot of uh, patients are seeking symptomatic improvement from pain and
Wow.
discomfort more than the cosmetic piece.
Right.
Nature of their symptoms, because we're thinking in terms of cosmetics when they're coming to us in terms of functional issues. And I think it's really important to view it from a different lens, um, rather than viewing it from strictly a cosmetic lens.
Totally.
And to be honest, if you do that, you're almost like superimposing your value system on the
Mm-hmm.
patient, which
Mm-hmm.
doesn't really seem fair.
Yeah.
I think it's important to just take them at their word.
Yeah.
And if they're having, you know, um, chest wall discomfort, back pain, neck
Wow.
pain, I think that we have very good techniques to address some of these problems associated with the implants. So it's been a fascinating area for me because
Yeah.
I think it's less technical than some of the other surgeries that I do, but I do like this sort of investigative nature of it to understand what is really going on with this problem.
Mm-hmm.
Because I do think that there is something there, and I'm trying to just even for myself, like conceptualize what is the actual problem and
Exactly.
what are the some of the data points around it.
Super interesting. I didn't know because I've heard people sometimes get a lot of colds or get allergies, but I didn't know it could cause even like back pain or neck pain. So you see a lot of those cases.
Yeah, I would say that in our kind of preliminary data that we've
Mm-hmm.
looked at, asking patients these questions, I would say the number one um, issue that they've had has been, but the, the most uh, the most prevalent issue has been chest pain, back pain, those types of concerns.
Wow, interesting. Okay, got it. That's super interesting that investigation that you're doing with actual data for a year with patients. Because I haven't seen that anywhere. I've seen a lot of people talking about the inflammation it could cause, but I haven't seen like data like that. So I think that would be very
Yeah,
interesting for
I think
everybody.
I think this will be the first paper of its
Uh
kind
huh.
because I do
Yeah.
have a very big experience,
Uh huh.
and I mean, at this point, I have several hundreds, if not 1,000, patients.
Wow.
So I don't know how many patients we will have in the study ultimately, but already I reviewed the data this morning, and it's very clear, what some of the trends are showing. So yeah, I think it's an exciting thing to put together. I think it's also going to be controversial because I
Yeah.
think a lot of people are going to be skeptical of the results and the data,
Mm-hmm.
but that's okay. I think it'll foster conversation, and I think it's really important for anybody when they're doing something to be a little bit low key obsessed with it
Yeah.
because you can't really pioneer anything new. You can't be creative. You can't solve problems unless you're a little bit low key obsessed with something. And so
Mm-hmm.
I'm a little bit low key obsessed with this problem because I think that it's just so poorly defined and so poorly
It
understood.
is. It
And I think
is.
that's not fair to patients because a lot of patients, are made to feel like they're crazy
Uh huh.
when there's an obvious thing that may be going on that can actually be addressed.
Correct. Correct. And a lot of the times, I don't think that they would always treat your back, so the symptom. But what if the problem is coming from something totally different, which is the implant? I don't think that they even consider that at this point.
Yeah, and I think from a larger perspective, our society is moving more towards kind of a natural, um, less less environmental toxins,
Mm-hmm.
fewer pharmaceutical based remedies. I think people are turning more towards diet and exercise
Mm-hmm.
and holistic approaches to their health. And I think that this implant removal trend that we've seen over the last, I'm going to say, five or so years
Mm-hmm.
is kind of alongside that. I think plastic surgery, like many things, goes through trends.
Yeah.
And let's say in the 1980s and 90s, it was breast augmentation was a really big deal.
Uh-huh.
Then maybe in the 2000s, like buttock augmentation was a really big deal.
Yeah.
And now I think we're seeing more of that like athletic,
Mm-hmm.
fit um, kind of look,
Mm-hmm.
and people are more attracted to that.
Yeah. Got it. Okay, now let's talk a tiny little bit about your business growth and digital marketing. Have you
Okay.
used any digital marketing to grow your practice?
Yes. So we have, obviously a website. We do a
Mm-hmm.
lot of search engine optimization through
SEO.
Google, of course,
Oh,
um,
nice.
uh, Meta advertising as well through Facebook and Instagram. We have our own podcast. It's
Oh,
called the
nice.
Best Podcast Ever. We've had, I think, this is our fifth season of that. Maybe I'll have
Wow.
you on our podcast.
Yes.
And so I think it's been a wonderful way to outreach to patients from like an educational standpoint. I do a podcast with a breast surgeon colleague of mine.
Uh-huh.
Also another wonderful way to educate patients. So we have not really, we're just now starting to look at AI and how to use AI to
Mm-hmm.
bolster some of our outreach efforts. I don't have a a full understanding how to do that. I should probably just ask ChatGPT how to use ChatGPT
Yeah.
for our practice. But I think that that is like the next for us, maybe the next frontier here of how to understand AI, how to leverage AI. I find all that stuff pretty confusing. Um, we have some stuff on TikTok. I'm not on TikTok. I don't do that much Instagram. I kind of maxed out at Facebook,
Uh-huh.
but I do know that these are very important tools
Yeah.
to really educate patients, outreach to patients,
Mm-hmm.
and ultimately to develop your personal brand. And I
Yes.
think in this day and age, everybody is like their own personal brand, for good or for bad.
Mm-hmm.
And
That's true.
and I think that particularly in medicine, particularly in plastic surgery, it's important to have a brand identity and for people to resonate with your brand identity, understand your story, understand what you're passionate about. I think all those things are really important.
It's yeah, because it's definitely based on trust. Whenever you're going to a
Yes.
surgery, you have to trust a lot. It's your life.
Yeah, I actually had a little procedure this morning, so
Mhm.
I was on the other end of
Oh.
this, and it was scary.
Yes,
And
it's
I was like,
scary.
I don't like this. I don't like being in this position because
Yeah.
I'm a control freak
Uh-huh.
and you're vulnerable. And it really kind of gave me some, insight to what my patients go through
Mhm.
because you are in a place where people are kind of poking you and prodding you, and it's uncomfortable, it's vulnerable, and you really trust that the place where under anesthesia or any
Mhm.
type of sedation. So yeah, it was a bit of a humbling experience, I thought.
It is. You have zero control, and they're doing whatever they want with you. And so, yeah, that trust factor, like just knowing, okay, this doctor, like, he's got me. It's the most
Yeah.
important thing ever. And I love that you're exploring a little bit about AI. I think all of us are right now on that train. We're all learning a lot about it. Super important and
How
super
how
interesting.
are how are you using AI in your business?
Yeah, well, ChatGPT, of course, like I use that all day, every day, not just business, but also personally. And then, for example, most of what we do is Google Ads advertising. This is not like very new with them, but they've had automatic bidding types that work with AI, and it's pretty good. So experimenting with those a lot more than before when I started, when it was like more of a, it was called manual cost per click bid. So you would have to go into each of the keywords and put a bid. Now it's totally different, and that has helped the work a lot. And I think that's about it. I'm also in that train of learning more and seeing something that I'm exploring right now is the AI agents, which
Mm.
you can kind of like teach them to do a task for you, and they just do it. So, for example, there are ones that do reach out, and they like you could teach it to go to LinkedIn and reach to all of the doctors in this area. And of course, it does it 24 hours, doesn't sleep, doesn't get sick, etc. So that's something that I am definitely looking into it because you have to learn how to do
Is
it.
your AI agent through ChatGPT?
No, well, there's a lot of other platforms, not through ChatGPT, but I think they are also having an agent now, right? I think so.
I haven't really explored the whole
Okay.
AI agent thing. I don't know quite how to use it.
Mm-hmm.
One thing that I'm doing that's funny is I use all of the different AI. So I'll use
Yeah.
ChatGPT, I'll use Perplexity, I'll use Claude,
Mm-hmm.
I'll use Grok,
Yeah.
I'll use um, there's another one. I can't even remember what it's called. Questions, similar questions, and see if the answers are different. They tend to be mostly the same.
Uh huh.
I think the ones that I am leaning towards most right now are ChatGPT and Grok,
Yeah.
the
Agreed.
1 through X. Yeah.
Agreed. The best ones for sure. I always use those ones. Mostly, I use mostly ChatGPT, but then
Oh,
sometimes Grok.
Gemini and
Oh,
DeepSeek
Gemini.
are the other ones.
I've heard that Gemini is like very good in voice. So like talking to it more than taping. That's what I've heard, but I don't use it that much.
Hmm.
Okay, and from all of the digital marketing strategies that you've mentioned, which one do you think it's the best one, or the one that was able to grow your practice the most?
I think the two that we've had the most success with, uh, number one was the podcast. We started the
Wow.
podcast during COVID because we were at home and we were like, what
Mm-hmm.
should we do? So we started a podcast. So I
Awesome.
think that surprised me, how many unique downloads that it got and how many people were listening to it. And I always see patients in the office and they would say, I feel like I know you
Yeah.
because I've listened to all of your podcasts.
Uh-huh.
So that was really interesting. That was a bit surprising to me. I think the other one that has been very important for us is there's a lot of kind of closed Facebook groups where
Mm.
patients will be invited into these groups to discuss a particular problem, whether it's breast cancer related or breast implant illness related or lymphedema related, any one of these types of problems. And patients in general, I think people rely on recommendations from people
Mm-hmm.
they know.
Mm-hmm.
And I think Facebook is just an extension of people that they know. And so
Mm.
if people in a closed Facebook group are very favorable on a particular physician or have a lot of insight into a particular problem, I think patients tend to trust that. And
Yeah.
so I think
Yeah.
closed Facebook groups have been kind of a big deal for us. And I think that the podcast has been a wonderful educational outreach tool.
Correct. And trust generator for sure. So yeah, a little bit more into those two things are a little bit more into trust rather than like
Yeah.
a Facebook ads or Google ads that is mostly yeah the person sees the service but they don't know you yet.
Yeah, it's funny because I think so much of medicine and what we are talking about, it is in line with national trends. I think
Mm-hmm.
we're all in a world where people trust institutions less, whether it's the
Mm-hmm.
government or CNN or whatever. Not to be too conspiratorial, but I think people tend to, even though there's more connectivity, I
Yes.
think people still, you trust who you trust, which are people that you have, 1, 2, 3 degrees of separation to.
Uh-huh.
And I think that even more so than in the past, organized medicine, is something that people are a bit skeptical about. And I don't think that it's a controversial thing to say that. I think after
Mm-hmm.
COVID, people have a healthy sense of skepticism
Yeah.
about what they are told. And I
Yeah.
think people now also have the tools to do their own research that they've never had before. I mean, the
Mm-hmm.
amount of medical information you can get from a AI
Mm-hmm.
platform
Mm-hmm.
is incredible compared to something like WebMD,
Yeah.
which was very kind of static
Yeah.
and difficult to decipher.
Yeah.
Whereas the AI agents will give you things in colloquial terms in a way that you can understand it.
Mm-hmm.
If you don't understand it, you can have them clarify it for you.
Right.
So the ability to do your own research and get your own information, I think, is unparalleled in medicine. And I think this is going to be the new thing that uh, physicians will have to deal with is not that educated patient, but the hyper educated patient.
Right. Which is it can be good and bad at the same
It can
time.
be because any of these things, is information in, information out. The quality information that it gives you really relies not only on the way you phrase the question,
Mm-hmm.
but also on the information that it's drawing from.
Yes.
And the more kind of esoteric the topic, you know, the less potentially trustworthy that information is. But then that's what, doctors are for, nurses are
Yeah.
for, is to give you an expert opinion. Again, give you a solution to whatever problem you're presenting them with.
Yeah, I heard in a podcast these days that like they think that in the future the doctors are gonna have to like it's gonna be by law that they have to have like that AI agent with them all the time. which is pretty interesting.
That's very interesting. I've
Yeah,
not heard that.
yeah. I like they do like future do future trends that they think they're gonna happen, and that was one of them, which is pretty cool.
What's a future trend in your industry?
Well, that agent part, like, there's gonna be businesses that are just like one single person, and then the rest is just AI employees. And
Hmm.
another thing that I also heard is that it's very cool. Like, they're not just gonna be like, let's say, like ChatGPT, but you are going to be able to give them a face, a digital face,
Hmm.
and
Yeah,
you are
sure.
gonna be able to even talk to them like the way we're talking right now. And let's say I'm an AI agent and I'm your employee, and
I mean,
that's the
you
way.
you may be an agent right now. I don't even know.
Right, exactly. Exactly. That's the way it's gonna be. We're not even going to know who's real and who's not real.
Yeah, it is a scary world, you
Yeah.
know. But I think just like anything else, like there's going to be tons of opportunities. I don't tend
Hmm.
to be a pessimist about these things.
Yeah,
You know, I
me
think it's
too.
really. I always feel like pessimism doesn't get you a lot, so there's no point in being a pessimist.
Exactly.
You might as well be an optimist. So
Yes.
I think it's very exciting. Like I think we're living in a science fiction age. We're like right on the cusp of things that you never would have imagined.
And there's this great phrase that says, "Pessimists are right, and optimists get rich."
Yeah, I think that's probably true.
And yeah, it's also about adapting, right? Like, yeah, you could. There's a lot of jobs that might be lost, but the important thing for all of us is to keep adapting and learn something new, because there's a lot of new jobs that are going to show up with the area. So it's just about just finding what else to do, and because you cannot get on the way of progress. It is what it
Yeah, I
is.
think it is true. Is going to be a lot of upheaval, though, which is not nice for people.
Yeah,
You know, I think. Right. Can you still hear me?
I hear you. Hmm.
I think there is going to be a lot of upheaval for people, which is not nice. And I think
Hmm.
that is something that is going to be reality of what we face. And we're all going to have to, you know, hopefully become less siloed and more invested in making, you know, our communities,
Hmm.
our society functional in the face of these real big technological changes.
Correct. It's they say that we're creating a new species.
Yeah, I mean, I don't think that we're nearly at the point where
Yeah.
AI is, you know, AI will always agree with you. You
Yeah.
know, if you ask it a question, it's going to agree with you. It's not at the point where it has its own will or its own, and who knows if that will ever happen, you
Right.
know. But I do think that we're getting to a point where we're in this, like, we're all a little bit of a cyborg. You have your phone with you all the time. You're always connected, and I think that definitely dovetails into medicine, and it goes along with the hyper-educated patient, which I think is a good thing. You know, I want
Yeah.
my patients to be as educated as possible, to ask good questions, because if they're asking good questions, it means that they're invested in what's
Mm-hmm.
going on.
Mm-hmm. 100%. I agree. Okay, and what do you think has been the biggest challenge for you in your practice related to digital marketing?
I think for me, understanding return on investment.
Mm.
So you put in X number of dollars for search engine optimization, Facebook ads, you know, other types of efforts. It's hard to quantify how many leads are generated,
Mm-hmm.
how many of those leads lead to a patient appointment, lead to surgery. I think I've had
Mm.
a hard time sort of tracking that entire workflow from dollar spent to dollar earned,
Mm-hmm.
which for us is essentially a patient that's recruited through our digital media spend
Mm-hmm.
translates to a person on whom I have operated, whether it's for cosmetic or reconstructive purposes. So that's been a challenge, trying to chart that whole system. I don't think we have a great solution to it yet.
Okay. Do you think that's also because it can take some time for the person to finally get approved for the surgery, or that
I think
wouldn't
that
be a time?
I think that's a part of it.
Mm-hmm.
I think we just don't have like a platform that integrates our digital marketing and lead generation
Mm-hmm.
effectively translating into our electronic medical record, um,
Okay.
such that we can identify I operated on this patient and this patient came from this ad campaign.
Hmm.
Like, we don't have a fully integrated platform to do that. I think our EMR would actually have to um, be integrated
Yeah.
into maybe our Facebook, Instagram, and Gmail accounts in a way that it's not.
Right.
So I think that's definitely a piece that's missing.
Interesting. Yeah, you guys would have to build probably like a custom solution, or doing it like in a very manual way, which sometimes we don't have the
It's very
time.
manual.
Yes.
Yeah, it's very manual right now, and
Uh
that's
huh.
how we do it.
Uh huh.
It's not really automated, so
Right.
that's why it's been hard for that data. So, I end up, which is not a great way to do it, but the way I do it is just kind of like a feeling, a gestalt,
Right.
like this is, but it is something that I need to figure out in a more granular way.
Yeah. Yeah. This definitely spend a little bit of time and see what you can do.
Yeah.
Okay. Well, thank you so much, Pankaj. It was great to have you. I loved the conversation. I loved all of your knowledge and insight. You also have a lot of experience with podcasting, which is great. It was very good talking to you. You're very confident, very relaxed. So I appreciate you taking the time.
Well, Maria, I appreciate talking to you, and I know there are some technical glitches. Hopefully,
Yeah,
you'll be able to sort those out. But
I will.
yeah, I'd love to see you on our podcast as well
That would
someday.
be amazing. Where can people learn a little bit more about you and your business?
Yeah, so our website is www.mwbreast.com, midwestbreast.com. You can find us on Facebook, on Instagram under MW Breast.
Beautiful. All right. Thank you.